Hi everybody, thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn and I run the services at medcommsnetworking.com and the associated websites. So those are services, information resources, activities for people who work in and around the global medcoms community and business, by which I'm talking medical communications, medical education, medical publishing, and the associated businesses. So you'll find lots of information, lots of things are going on. Importantly, if you go to NetworkPharma TV, you'll find hundreds of videos now. Many of them generated from webinars like this, but also additional videos, lots of video content on all matters around medcoms and related matters. And a quick shout out to those of you who have any interest in joining medcoms as a career, maybe as a medical writer, account manager or whatever. You'll find lots of information at firstmedcomsjob.com specifically. So today, absolutely delighted, we've got the guys from AMICULUM and Dundee, and they're talking to us about a new master's that's starting about healthcare communications, science and healthcare communications. So great to have you guys. I'm going to hand over to Nicola to kick us off.
Thank you. I assume if you just nod, you can see the slides. Brilliant. Well, thanks everyone for joining the webinar. I'm delighted to join the team here to talk to you about the master's course in science and health communication that we've been working with the University of Dundee on. My name's Nicola Duckworth and I'm the operations lead at AMICULUM. And as I said, been part of the core team developing this course. I've just passed to my colleague Sheetal for an introduction from her.
Thank you, Nicola. I'm Sheetal Patel. I'm the learning strategy lead at both our healthcare learning agency, Delta Care, and also our own internal learning development at AMICULUM. I've been involved in conversations about this degree from when the idea was first floated, and it's been great to be part of that journey from initial conception to now, where we're looking at the first intake of students in September 2023. So very excited to be here, and I'll hand over to Erin.
Thanks, Sheetal. My name is Erin Hardee. I'm based at the University of Dundee School of Life Sciences, and I am the co-lead for the new master's programme. So I've been involved since the beginning and mostly around the development of the curriculum, working with AMICULUM to bring in some really exciting content, and I will be leading on some of the modules as well in the upcoming years. I'll pass over to Marios now.
Hello everyone, my name is Marios Stavridis. I'm the Associate Dean for Learning and Teaching in the School of Life Sciences at the University of Dundee. And my involvement in this program has been from the inception. I was contacted by Richard Alcorn at AMICULUM and we got the ball rolling and involved several other people some of whom are on the call here today. And I'm here to answer some of the questions. I won't be presenting.
Thank you.
I'll pass back to Nicola.
Thanks very much. Sorry for the moved ahead to the agenda. So yeah, we've just got a few slides to share with you to sort of set the scene about the course, how it came about, and then our role in its development. Erin's going to cover a little bit about the course itself and what we cover, and we'll also look at some of the practical aspects about, the duration, virtual, hybrid, that sort of thing. And then we'd love to hear from you with your questions and have a bit of a discussion at the end. So kind of where it all started, as Sheetal mentioned, it kind of started about 5 years ago when we set up an office in Dundee and it was based on the campus. So that really established our sort of presence there and our links with the university. And then the discussion sort of moved along with our co-founder, Richard Alcorn, and the deans who were really interested in trying to develop a specific master's programme aimed at our industry, which is MedComms, but sort of any allied topics as well. Then due to some staff changes and then COVID, nothing really happened for a couple of years, but then Marios got involved 2 years ago and re-established those connections. And then from there, that's where the momentum's really kicked off. Sheetal and I got involved as well with Marios, and we started talking about the course and what it could cover. Sheetal will explain a little bit more in detail about the sorts of things that we did. And also the university worked really hard to try and ensure that there was enough demand from students. We had input from the industry to say, is it a feasible course? And obviously the good news is that all those things were quite positive. And Erin and Laureano de la Vargo joined as co-leads in April last year. And then we got the green light to go ahead from June. And then since then, that's when actually the hard work has really started, where we've been working hard developing some of the modules and helping the university with those as well. We were really happy and quite proud earlier this year to establish an AMICULUM funded scholarship, which would cover the fees for a UK-based student to join the course who may not necessarily have had the means to do so in the past. And we've named this scholarship after our late colleague, Emily Travis, who unfortunately died from cancer, but whilst she was receiving treatment, she was really advocating patient empowerment through knowledge and, about treatment regimes to understand, to make sure patients understood treatments they were receiving and how it would impact them. So we're really pleased and proud to get sort of approval from the family to name the scholarship after her. So we often get asked the question, well, why is MedComms doing this? What's in it for us? It goes back to sort of establishing that, further establishing our relationship with the university. We've got really great links with them, and it's something that we thought would be a great thing to do. We also felt that AMICULUM could really add value to shaping the content of a course, because there's nothing quite like it. There are other science communication courses out there, but we felt having a course with quite a strong industry link would really help students once they've qualified. We believe it helps differentiate us from our competitors. This is what we offer. And it's great to be associated with the University of Dundee as a leading academic institution. We talk a little bit about giving back. AMICULUM, we've been very fortunate in the industry, and we feel to help further the MedComms industry, as it were, and to almost expand the diversification of people coming in and the talent coming in. This opens another door to students who may not necessarily have had the opportunity before. Of course, we'd be delighted if people coming through the course would then join us. So it's an opportunity to recruit. And I can't see that the last box, just one moment while I move my pictures. There we go. It's an opportunity for some of our staff to actually get involved with developing the lectures and facilitating workshops. I mean, it's very much a university course, but we do have the opportunity for some of our team to get involved as well. So I shall pass over to Sheetal.
Thank you, Nicola. So I'll spend a few minutes talking about how we've contributed to the development of this degree and the support that we'll be providing. You just click next, Nicola. Just as an overarching comment, I think we recognise that students will be interested in this as a conversion degree, so the route into a profession that their undergraduate degree didn't perhaps set them up for specifically. So we want to give students as much access as possible to our industry insights, our on-the-job experiences, so that they get a glimpse of what it's like to perhaps apply some of that learning in a role in the sector. So at the very beginning, we started with helping the university with their market research and feasibility assessment. For our part, we compiled a survey and we sent that out to all of our team members at AMICULUM, experienced or new. And we wanted to get interest. What did they think a course like this would be useful? And if so, what kind of topics would they want to see on it? So for experienced team members, you can see how they might be looking at this from a training or recruitment perspective. So what would they want to see in an applicant who's perhaps done a degree like this? But also from newer team members who aren't as experienced, I guess their learning curves are still quite fresh in their minds. So it's interesting for us to understand what they felt would have been good to know before they joined the industry, or what would have prepared them as a good foundation for the role that they're doing now. So we fed all those results back to the university, and that fed into the research and activities that they were doing. Next, please. Thank you. So we did find, of course, there's a big appetite for a degree like this. There's a lot of enthusiasm on both sides, industry and academia across various schools at the University of Dundee, and I'm sure Marios can talk more about that. So we set about working with a team, putting together the bare bones of an ideal curriculum. What should that include? What should the topics be? What order should we deliver them in? Should they all be core modules? Should there be any elective modules? So we had lots of discussions around that. And once we nailed that down, we then started fleshing out the details in terms of the number of hours of lectures versus workshops, self-study time and assessments. And all of the time we're keeping in mind learning principles and models and design best practice. So we're making sure we're designing a really impactful curriculum here. We've built up a lot of experience of workplace learning in the sector and really understood what the training needs are, what the challenges are. A lot of that is with our own work with our internal learning ecosystem, the AMICULUM curriculum, and we've shared those activities and that learning with the university. We've mapped out learning journeys for various different skill sets and roles beyond just medical writing, and that's been a really good starting point for us. And that links into the next point, where we have lots of existing materials that are very relevant here, and they're designed for on-demand use. So some of that content is in e-learning form, some of it's short form video, but we're planning to give students access to those materials as pre-reads before they come to the lectures that we'll be contributing to. So using a bit of a flipped classroom model, they come with a bit of an understanding, and we can then use that face-to-face time to go through that content, consolidate that learning, and use that time for face-to-face question and answers, discussions, and really practice-based activities. And then on the right-hand side, of course, we've got very enthusiastic subject matter experts who are very keen to get involved and help deliver this content. You can see some of the lineup that we have for the first semester. We're contributing to 2 of the 3 modules in the first semester, and the second semester we're contributing to all 3 modules, so there'll be more of our team members who will be sharing their expertise there. The next point is coming back to what I said earlier about bringing in those practical insights. We really want to share our experiences, our insights, the practicalities of working in this industry, some of the nuances and the real world applications. And we're thinking about that not only when we're scoping the modules and planning the content, but also when we're looking at the activities and the workshops and the kinds of things that the students can do as hands-on activities. So the next point, part of that relates to making sure that the content that we provide in the course and the experiences that the students leave with are relevant to potential recruiters, so they can hit the ground running if they are interested in joining the sector and taking a role up in this field. We are providing also support with internships. So in the 3rd semester, we'll be offering 1 or 2 placements depending on the final number of students. It is an elective module in the 3rd semester, so students can either opt to take an industry placement or take on a university-based project, and I'm sure Erin can tell us more a bit about that later. And then finally, for anybody who is interested in joining the industry, we can of course provide careers guidance and mentoring support, and I'm sure there'll be lots of informal conversations, discussions within the lectures, but we can do that in a more formal setting as well. So that's a quick overview of the kinds of activities that we've been involved with, and I'll hand over to Erin now, who can tell us more about the degree itself and the courses and what they cover.
Thanks so much, Sheetal. So I'm just going to go over a few slides that kind of give you an overview of the content of the different modules. It will not be too in-depth, but I will just pop into the chat a link to our website that will give you some more details about the course, its contents, and how to apply. So if anybody's curious, you can have a look there. As was just outlined really nicely, we feel that this course is really unique in that it was developed through our kind of work in consultation with AMICULUM, who are leaders in the industry. So we feel really confident that there's a lot of very up-to-date, very relevant information coming from the industry. So it will prepare people well to know more about that and to possibly go into that industry if that is their goal. So the key areas that will be covered in our modules involve critical analysis of all different types of scientific data through journal articles, data sets in clinical trials, statistics from epidemiology studies, etc. We'll also talk about different press and communication skills. So that involves sort of, again, more critical analysis of existing data and being able to resubmit it, reimagine it for different audiences. We'll talk about audience profiling and behavior change. So looking at it from sort of a marketing and communications point of view, how do people take in information? How do they best learn from and engage with information? And how can we ensure that we're working along those lines in our communications with them? And then we will have some really, as I said, up-to-date information about the current landscape of the medical communications industry. So that will be coming from AMICULUM. So you'll be getting sort of what is current, what is on the near future, to really prepare you for what that will look like if you were to go into that industry. Next slide, please. We haven't just consigned ourselves to those topics, though. We've brought in quite a lot of other sort of specialities. So here at the University of Dundee, we have a really strong School of Art and Design. So we've got contributions from them on all sorts of written and visual communication, graphic design, the use of social media in science communication and storytelling. So you'll get a lot of sort of experience in creative expression and using different media to communicate with different audiences. And we will also be having input from our School of Life Sciences and School of Medicine on specialist scientific topics. So a lot of science communication courses focus more on sort of theoretical knowledge and the history of science communication, but we're going to be looking very much forward in what is the science landscape now? Where are the ethics and research in healthcare going? What sort of therapeutics are being developed? How is drug discovery playing into this? And how do we kind of look ahead to translational medicine? So making sure that all of our graduates are sort of up to date on this and really aware of the current landscape. Next slide, please. And lastly, we're going to be covering topical issues. So we'll be looking at fake news, audience manipulation, so the role of the media in the communication of these topics to various groups. We'll be looking at the use of AI in communication because it's going to be a big tool that we will have to learn how to use well and responsibly. And we'll also be looking at things like rare disease communication, so sort of niche fields that I think will be growing and developing much more in the coming years. So we'll try and stay on the cutting edge of that. And the benefit to coming to Dundee for this is that all of these topics are going to be taught by experts in the field. So we have obviously AMICULUM's expertise, and we also have our life sciences and medical education group, which are leaders within the UK and the world for impact and for teaching. So you're going to be getting a really solid, very, very good experience coming to our particular course. And the way that will look, if I can see the next slide, is that over 3 semesters, you'll be doing a number of different modules. The first 2 semesters, all modules are mandatory. So you'll be taking 60 credits each. And we will be covering, as I have outlined, a variety of both scientific focus, communications focus, skills and tools focus, and also sort of the landscape of these different areas. And then in semester 3 over the summer, you'll have a final project, which will either be a dissertation if you are looking into how to writing something up academically, or a placement within an industry partner. So that may be AMICULUM, it may be some of our spin-outs here at Dundee, or it may be other industry partners that we reach out to. But hopefully this final project will really allow our graduates to build the beginning of their CV in this, or add to their CV if they're in the medical communications industry already, and give them a really sort of practical project-based focus to put their knowledge into practice. And our last slide, please. Just some of the logistics here. This is all covered again on the website that I've posted, so you can have a look there if you want to refer back to it. But it is a 12-month course. It's full-time, and the first year will be running in person. So that's here in Dundee, Scotland, which is, I can hopefully say, a lovely place to be. and it's open to applicants from a really wide range of backgrounds. So obviously we are looking for people from sciences, the healthcare and communications media, but we're also open to a broader cohort than that. So if you have an expertise in art and design or other sort of marketing and communications, and you're interested in bringing that over to a science and healthcare focus, we would be very keen to see people from those backgrounds as well. And the opportunities that will be available to graduates will include obviously working in MedComms, perhaps as a medical writer or in scientific publishing, but could be wider than that, could be media officer for charities or other organizations dealing with healthcare and science research, or going into public engagement as a professional worker there. So very happy to answer more questions at the end, but I will stop talking for now.
Thank you. So hopefully you've got more of an idea of our approach and what the course actually entails. If anybody's got any specific questions for us, our contact details are there. But yeah, happy to open the floor to questions.
Excellent, thanks guys. Can we just lose the slides, and then, as you say, we'll have a bit of a Q&A session. Anybody in the audience wants to, please, we'd love to see your questions and comments coming in via either of the two text boxes. Can I just kick off? I'm slightly curious about how something like this comes together within a university like yours. Marios, can you tell us a little bit about just the process? I mean, I'm aware from a couple of things I've seen in the past that this can be quite a complicated, quite a long, drawn-out process. You've got a few hoops to go through. Can you just paint the picture? What happens in a university? Why do you start looking at something like this? And what is the process that's then involved to get to the stage where you can offer it?
Absolutely. So universities obviously have they have a social purpose, right? We're there to change lives, and in order to do that, we can teach things that we've always taught, and we need to look around at what is the need. And through our communications with various stakeholders in this industry, we've come to realize that there is a need for more training in science, healthcare, health communications, medical communications. We know this because some of our graduates for many years now have been going into this industry. So through a connection made by Richard Alcorn from AMICULUM to the former principal of our university, AMICULUM got a base in Dundee, and then Richard got in touch with my predecessor as associate dean. That, because of COVID, went into some sort of slow period. Then I picked it up and we started doing this. The obvious thing is to not do a program like this purely based on a single school. The idea is a university has a wide variety of stakeholders, a huge number of expertise in all of these different areas. And that was the most exciting thing about putting a program like this together, was that we reached out to all of the schools and said, this looks like a really exciting thing. Does anybody want to be involved? And suddenly we got a whole bunch of people coming together, and we had to appoint somebody to lead this. I can't do all of this stuff. That's not what I do. So Erin has taken a lead together with a colleague who unfortunately couldn't be here today, Laureano de la Vega. And together we started talking to the MedComms industry. We put surveys out, talked to potential employers, talked to current students at the time of our university, what things they expect to hear in a course like this, what would they like to do when they finish. And then all of this together fed into creating a program. We had to then get this through a university quality assurance process to get that approved. And now that we're ready to do it, we've got all of the nitty-gritty in place. We're very excited to launch it.
And to be blunt, I mean, it's a couple of years, I think it's a couple of years you've been working on this. Is that a fairly typical timeline for something like this within the university?
Yeah, unfortunately, higher education institutions are a bit like super tankers. To change direction, it takes quite a long time.
Okay, but that's the sort of amount of time that would normally be involved. So broadly, I don't know of anything quite like this that's out there. I'm sure we'd all be very happy if somebody told us we were wrong. I am aware that there's been a couple of attempts in the past to do MSc type level activities, but at the moment, as far as I know, this is the only one of its sort, and this is very closely mapped to the AMICULUM services, the MedComms, but the broader healthcare communications type services. Just out of maybe I can, Nicola, you can comment a little bit. You know, when you look at what people are coming in with at the moment, you know, except in the fact there's nothing quite like this. Have you got any comments on what's out there at the moment? What sort of courses might people be, bearing in mind this isn't going to suit everybody anyway? So just spend a minute or two. What other courses and activities like this might people want to look at, or might people be doing at the moment?
Yeah, I mean, I think there are quite a few different science communication, health, general communication, media type courses. But what we found is they're more general and can cover, you know, a lot of public policy, a lot of, you know, talking to media. And it seemed to miss the MedComms focus. So whilst this is MedComms focus, we do talk about the best, but I'd say the majority, and I think there's a question about what's the proportion that is MedComms specific. Yeah. Off the top of my head, I don't know, probably I'd say 50 to 60%, Sheetal, would you say? But yeah. So it's not solely MedComms, but it's definitely heavily MedComms. But
I mean, to jump in there, I mean, that slightly depends on how you define MedComms in the first place, doesn't it? Yeah. Sort of thing. So we probably don't want to go too far with that one. But just as I said, to pin you down slightly, do you see other people coming in? So do you see people coming into AMICULUM and the MedComms business with other types of courses, or forget the MSc level type courses? What other courses can people take at the moment that heads in the right direction?
I haven't really seen that many.
There's certainly no magic course out there. Okay. And this is very much a sort of a course for people who want to come into, let's call it healthcare communications. It's not specific for writers, account managers, editors, or anything like that, is it? So this is about coming and understanding the business, and then you would be trained as a writer or account manager or so on.
Yeah, that's right.
Okay.
Yeah, we cover quite a few. We've made it broad enough. Hopefully, it's not a medical writing course. Definitely not, but there's elements of it, of course. But we do cover across the curriculum things like, the social media, there's design, storytelling, there's all sorts of, you know, different aspects. So then people can understand what we do as a business and what our clients need us to do. And then after that, they can hopefully then specialize into what they want to do.
Yeah, so part of the point of this is to get work experience, or certainly experience of talking to you guys. They'll start to understand the difference in client services and writing and so on. You did, I don't want to get too bogged down in this because we've already said it depends on how you define things, but you've mentioned things like press activity and so on, Erin. You know, let's just be clear about this. AMICULUM have been involved in this. That's great. You've got some industry input, but have you had other people involved from those sorts of other areas of industry, like press relations or whatever? Or is that an in-house expertise you already have?
Yeah, so we wanted to be clear that this is a course developed and delivered by the University of Dundee. So while AMICULUM have contributed and continue to contribute, we wanted to bring in a lot of skills from within the university. And so, as Mario said earlier, I'm not sure we have a course that's quite this interdisciplinary anywhere else. At my last count, we had 5 schools involved, which is absolutely spectacular. So we have our School of Business, our School of Education, School of Medicine, School of Life Sciences, School of Art and Design. So we've got experts from quite a lot of fields. And my background personally is not MedComms, it's broader science communication. So I wanted to make sure that what we were covering was going to be a really good basis for people interested in not just MedComms, but a kind of wider, how do we tell stories about science? How do we assess and you know, analyze things to be able to then communicate them to, you know, any number of different audiences. So I think we certainly will be having input from people within BBC Science team, people within our own press office, and sort of not focusing on that specifically, but making sure we are kind of winding that through so that people get a glimpse of the variety of things that can be done with this sort of knowledge and skills.
But can I be clear? I mean, you haven't had other healthcare communication agency type input, but you did imply that at the end when they're doing their work placements and so on, yes, obviously AMICULUM's one choice, but you did, I think, say there may be other people involved. So are you putting a call out to other agencies to say, yes, we would be interested if you know,
we
can
would
do work
absolutely
placements
love
Okay.
to have more industry involvement, certainly in the placements. We want to make sure that the placements we provide are within companies that are working at the cutting edge. So people who are there right now, if they're looking for students that, you know, will be really skilled up and kind of keyed into the key areas, then we would love to work with people on that. So as the slides had our contact details, please get in touch with us if you'd like to host, or if you'd like to contribute and have discussions about how you might be able to speak with our students. That would be fantastic.
Okay, we had a couple of questions coming straight away, and let's just cover this one off. You've made it very clear this is an in-person event for a year or so at the moment, but several questions came in terms of remote learning opportunities and so on. Is that something that you can at least think about in the future? How does that pan out? Have you got any thoughts that you can share on that front?
We are very keen to offer remote learning. We decided upon the first year it would be really key to have in-person opportunities, just because it's, you know, it's inaugural. We want to make sure we're delivering really high quality, but we certainly do have it as an aim in the near future to allow remote learning opportunities, because I think that would widen our scope a little bit in terms of who we can recruit. And I think it would be valuable for people who can't physically come to Dundee for the year to be able to take part. So I can't give you a firm timeline on when that will be, but it is certainly very much in the front of our minds to keep
this has been something that came through in our initial consultation when we asked people in the sector about what would an ideal program look like, and everybody said it needs a distance element. And of course, I understand that this is a largely remote workforce. It seems perverse to create a program that is only, you know, turn up and do it here in Dundee, because, but this is the first time we're doing something like this, and it is difficult enough to have such an interdisciplinary course put in a relatively short space of time in person, where we really know what we're doing. There are many other programs at the university who are distance learning. So there is huge expertise in distance learning in the university, particularly in the medical school, has really large distance learning programs, and we're very keen to learn. So we've got involvement from the people who run these programs and advice on how do we then take this program and make it suitable for distance learning. But in the first instance, we want to run it at least a year, just make sure that it's right before, because it will, as you can imagine, it'll scale very differently once it goes online. So we want to make sure we know we can handle the size of it too, right?
Yeah. A couple of comments are just coming in. I think, you know, in person is important, not just from a training point of view, but etc. But there's a conflict now, isn't there? There's, you know, conflict for a long time, but it really is now. You know, there's a lot of people out there who just go, why should we go anywhere? You know, we should be able to do everything from our desk, sort of thing, particularly, as you say, for a business like ours, which is very much about remote working anyway. And Steve saying AMICULUM has an international footprint. So again, you know, I guess your answer would be anybody can come in to Dundee for a year and do this from anywhere. From Nicola's point of view, or Sheetal's point of view, bring you and Sheetal, I mean, you know, anyone, anywhere in the world, you have offices everywhere. Has this been designed from an AMICULUM point of view, sort of with one eye on the fact that someone might pop up in another part of the world and say, I've done this sort of thing? There shouldn't be any difference, should there, across AMICULUM?
Yeah, no, we were looking to make sure it was open to as many people as possible, again, to really, you know, diversify the talent coming in. We didn't want to restrict it.
So, okay, so let's get some, and Sheetal, I'm going to drag you into this one, okay? So a couple of people, Claire has asked, let's just, I'm just trying to imagine who's going to go on this, okay? Who's going to apply to this, okay? And at the end of the day, not everyone's going to have the funding and all the rest. There's some practical issues there. They don't necessarily want to be in Dundee, etc. Forget the practical issues. The sorts of people that are going to apply to this, is it overly simplistic to say that this is the sort of, you know, somebody with a first degree, you know, looking to do an MSc, they've already worked out they want to go in the direction of healthcare communications, and they go, aha, there's an MSc that's specific for that. I mean, the alternatives being that they would come into a company like yours and get training, or, you know, your PhD postdoc types who would come into medical writing, you wouldn't particularly expect them to go back and do this, would you? They'd come in directly. Just give me a sense of the sort of people you're thinking are going to do it and the reasons why they're doing it?
Also, I think we're hoping to see a mixture of people coming, having done undergraduate degrees, and people who have done PhDs who are looking for an alternative career in science that isn't research. I remember when I joined the industry, I came across medical writing. I thought that was really interesting. I love science, I love writing. I didn't know much about it. And it's overwhelming actually trying to understand like the landscape, medical communications landscape. And even as a medical writer, you've got a regulatory writing all the way up to PR and copy writing, and there's a big spectrum. So I think rather than if you join the industry, it's almost you take a chance on what you think feels right. You're not quite sure where you might feel, where your skills, where your interests lie. I think this gives you a nice foundation to kind of explore that, understand what the industry is all about, get a bigger picture, and then make a more informed decision, I guess, about what agency you join and where you start that journey. I think we've talked about this, we're hoping to see applicants not just from a broad range of backgrounds. I think when Erin spoke there, we've involved so many schools from the university to see the diverse skills that are coming into this programme. So we're hoping as well as people who have done degrees in core science subjects, we might see other people who might want to roll in the industry who aren't necessarily scientists but have an interest in joining the field.
I guess what I'm thinking is, and correct me if I'm wrong, but or on any of this, correct me if I'm wrong, but AMICULUM, you've got a pretty well sorted out AMICULUM curriculum training program for people to come into your business, yeah, and they can come in from various backgrounds and they go in at a trainee level essentially, and they start on that route. I know the curriculum then takes them through their career sort of thing. So if somebody comes in having done this MSc, does that shortcut what you're going to do with them in any way at all, or does it make it more likely you'll take them on in the first place? Does it shortcut the training you're going to give them? Does it influence, or is it just another route in? You're going to have certain skills that you wouldn't have had anywhere else, but there's somebody else who didn't do this who has other skills, but you come into the AMICULUM curriculum type of training program and you will move forward. Am I oversimplifying it, or am I missing the point or something?
I think it's just another route in. I think with curriculum, with all the learning at AMICULUM, we're trying to personalise those learner journeys. Everyone comes in with different experiences and different backgrounds. So I don't think it will impact. We don't have a very set curriculum as a training right to start here, and these are all things that you go through. It's very personalised, it's very tailored, and it's very flexible. So, and I think people that come in, with they might have expertise that they want to share as well, they can contribute through the curriculum. So, it's a dynamic, we call it an ecosystem, because it's not a download or an end-to-end journey. It's contributions from everybody within the curriculum that contribute.
Okay, fair point. Yeah. I mean, maybe it's worth for context. There are agencies who've got very formalized programs out there, others who haven't, and arrange them in the middle sort of thing. So I guess maybe a comparison will be with some of the agencies that have a very formalized one-year program or whatever, and it might be interesting to see how this fits together with that. Somebody was asking in here. Oh, sorry, I cut across you there, Nicola. Did you want to say something? Sorry.
No, it was just on the question about how how does this differ from somebody going into a graduate program, and I guess probably that the diversification, if once you join a graduate program, you've kind of picked what you're going to do.
Yeah.
Whereas this is like almost the step before is like you might like MedComms or a part of it, or you might want to prefer to go down regulatory writing, but if you've joined a graduate program in an agency that doesn't have that service, you're kind of stuck.
You're starting to go down the line.
It's a bit more open, and then you can channel later on.
Yeah. So I think Steffi's asking whether there's training and materials, key skills for client management, project management. So I guess you're going to say yes. I think we talked about that earlier on. This isn't a writing course or something. This is about the general business, isn't it? And then somebody would take them on and train them in a particular area.
Can I just jump in and say that there's definitely a focus on client management and product management. We'll talk about tools. Some of the assessments will be around using these to create project plans and sort of going through that process. So I think it will be a really useful sort of I think, for any walk of life to be able to do these things, but certainly for within MedComms, they'll get a really good grounding in that. And AMICULUM will be coming in to talk specifically about what they use, but we'll also have some other tools available for people to become familiar with.
Okay, just maybe to wrap this up, although someone's just sent a question there. I was looking at Bryony's question. What she's asking about the benchmark, university benchmarks. What, how are you assessing? I'm not quite sure where I'm going with this question, to be honest. I suspect, but hopefully you do from Dundee. What are the benchmarks? What's the assessment type process? Is there anything, I don't know, different to normal or whatever? Just give us a sense of how you're assessing and what somebody comes out with at the end.
Sure. I mean, there are no real benchmark statements from the Quality Assurance Agency that directly prepare people. This is an area that is chronically underserved by higher education providers. So we're doing it. That's why we're so excited that AMICULUM is bringing in their expertise, and the assessments are as authentic as humanly possible. We don't want people. I mean, in the era, you've had excellent discussions in this forum, Peter, around AI, the impact of AI in this industry, MedComms industry. It's AI and generative models are disrupting the whole of society, disrupting higher education. Assessments are really, really challenging to do these days. So we need this to be as authentic as humanly possible. We don't want people to be writing an essay about how you might possibly approach academically project managing a science communication job. Nobody wants to do that, right? Nobody cares about that. They want to they want to learn how to actually do it. That's in
real life. Okay. We should be probably wrapping up. Is anybody got a final couple of or from the AMICULUM point of view, anything you want to say? No, we covered the ground. Yeah.
If people have got questions, then please do get in touch with us.
Yeah. Okay. Why don't we wrap it up there on that note? I know you're all very happy for me to say that people can contact you via LinkedIn is an easy way of doing it, sort of thing. So let's hope. I would encourage people to have a look at this. As I say, it is a little bit different to what else is out there. So hopefully we've given some people some food for thought there. I'm going to wrap that up. So let's say goodbye to everybody, and then people in the audience, don't run away. We've got 10 minutes or so. We can carry on talking for a little bit before we shut down. But huge thanks to you guys. Huge thanks to the audience. If anybody's interested in what I'm doing, medcommsnetworking.com. But let's just say goodbye to everyone. A little wave and wish everybody a safe day. Take care. Bye.